Welcome back. Well, today I am joined by Sherry Hogue, who is here on behalf of MemorialCare Saddleback Medical Center. And she is a nurse navigator, and we're going to be talking about lung cancer today. Well, Sherry, thank you for joining me today.
Thank you, Lisa, for having me.
Now, this is the first time that I've interviewed you, so welcome to our show. And then also, just to find out a little bit about you, please let us know kind of how you arrived at this point in your life.
So I've been a nurse for too long, but I've been in oncology for most of my 27 years as a nurse, and I've actually been oncology certified since 2003. And when we moved here to California back about 11 years ago, I got into nurse navigation and really enjoy this type of oncology nursing because I really get to spend time advocating for patients and teaching them as much as I know and can find out for them, and just helping them get through their journey with cancer.
So can you be a little more specific? We've interviewed a lot of different people, but I don't know if I've actually asked a specific question in terms of what an oncologist is.
So an oncologist, well, it depends on, there's different types of oncologists. You have medical oncologists that actually do more of the treatments. Radiation oncologists do like the radiation. So, and then you have your surgical oncologists that do the surgeries, and they'll be, a thoracic surgeon, for instance, with lung cancer, but you have many different kind of levels when you talk about oncology.
Okay, yeah, it sounds like it, and specifics too. So when you say that you are trained in oncology services, what is it you have to do?
So for oncology nurses, we really have to know the whole spectrum of oncology. We need to know what the actual procedures are, the diagnostic type of exams. We need to know all of the treatments, from chemotherapies to radiation to all the different surgeries. And then we also need to, understand all of the different aspects to the disease process.
Okay.
So it's a big undertaking to become certified, definitely, and years of experience helps with that.
Well, exactly, because you never really know what your circumstances will be and what you're being thrown into. So
right,
that is a lot, I can imagine.
Yes.
Remember all of that must be pretty hard. But specifically today, we're talking about lung cancer. And again, you would have to know so much about this specific entity to be able to treat people with that. And interestingly, lung cancer is this really the leading cause of death right now?
It is. I know it's surprising because it's actually the third most commonly diagnosed cancer in our country, but yet it's the number one cause of cancer deaths among men and women. And yeah, it actually, more people die from lung cancer than do breast, prostate, and colon combined. And so it's really shocking because, you think everybody knows somebody that's had breast cancer and colon cancer. And so you automatically think those would be the leading causes, right? But lung cancer is just one that's evaded us a little bit. But we are actually, there is good news that since the 90s, we've been seeing a decline in these death rates. And it's mostly because of people stopping smoking. So smoking is the number one risk factor for lung cancer, and it is actually associated with 80% of all lung cancer diagnoses.
Right, but that doesn't mean that people who are currently smoking. I mean, that could mean people who maybe smoked for 20 years and gave it up.
Correct. Yes. So, I mean, risk factors for lung cancer include former and current smokers, and it usually has to do with years of smoking.
Right.
obviously kind of with anything, the more exposure you have to a cancer causing agent, the more likely you are to develop cancer.
Okay.
Yeah, sorry.
That's okay. So let me ask you this. So, you know, a lot more people these days with the legalization of recreational use of marijuana. Well, that's smoke. Have they done any studies about what that's doing to the lungs?
You know, not as much as with tobacco, although we are starting to get into looking at that, but also looking at vaping. So
Yeah.
the cigarettes, excuse me, they, you know, people think that they're not getting nicotine from those, and that's kind of been the, you know, the thought behind it is even teenagers think, oh, well, I'm not getting nicotine, I'm not smoking a cigarette. But
Right.
actually the pods, like a jewel pod of for vaping is equivalent, one pod is equivalent to 20 cigarettes. It's a whole pack.
Man, that's
So
horrible.
yeah, so it really is, you know, it's scary because they're kind of, you know, there might be some misleading going on behind that, that especially younger people don't understand.
Well, right. And you know, and now 10 years down the road, you may have more cases on your hands of lung cancer, although it's not necessarily proven at this time, but
Right.
down the line, you never know.
Well, and I think one of the things that our older population is doing is thinking, oh, okay, I'm going to get away from cigarettes and I'm going to try an e-cigarette. But
Mm,
again, they're not understanding that a lot of that has nicotine in it as well,
yeah. Well,
even a small amount.
do the research before you go
Yes.
down that path for sure. Now, one thing I think is interesting is that we've talked a lot about the risks and things, but you know, when you go to your doctor and you know, you explain some of your history and things like that, at what point do they decide to test for it?
So we normally lung cancer, that's kind of one of the problems is that we are not catching it until later stages because the symptoms don't come about until you're normally in a later stage,
Mm,
which is pretty common with a lot of cancers, right?
mm.
But we do have now a type of screening. It's called a low dose CT scan that can screen patients for lung cancer.
Okay.
However, you do have to be a smoker or a former smoker um, to be eligible for this type of screening.
I see. I see. And I'm assuming based on what we were just discussing that discussing is that at some point that could change based on what we're seeing today in terms of younger adults and other people who are partaking in some of these other smoking methods.
Exactly. So right now, the guidelines for, or the eligibility criteria for low dose CT scans is ages 55 to 77.
I see.
But the average age of diagnosis of lung cancer is 70. So the United States Preventative Task Force in 2021 came out with a new guideline extending the age from or to 55 to 80. And that should give us, you know, a better range of catching some of these cancers. However, CMS, which is the Center for Medicare and Medicaid Services, they kind of lag behind a little bit on these guidelines, and reimbursement has not been set for those age groups yet. It still is 55 to 77, and you have to have smoked at least a pack a day for 30 years and be either a current or former smoker having quit within the last 15 years. So
Wow.
those are the three big criteria to be able to get screened for lung cancer.
Now, are you on a committee of some sort that helps to monitor that or to raise concerns that maybe things should be happening at an earlier stage?
Well, yes. So we, you know, being part of kind of the oncology world, we all are pushing for these different guidelines to kind of expand and be able to reach more people, because we know that diagnosing earlier means better chances of survival.
Exactly.
So yeah, and also as the nurse navigator here at Saddleback, I run this lung screening program.
Mhm.
And so I'm constantly working with patients to get screened and trying to reach out and find those patients that maybe don't know about screening.
Yeah, yeah. Well, that's good. I mean, I'm glad that there are people like yourself that are out there pushing for this, because it does seem like it could be something that you could test at an earlier state, given the information, and of course, any
Right,
new information that comes out along the way. So that's
right.
great. Now, if somebody was interested in learning more about what we've discussed, or maybe how to get a CT scan, what do they need to do?
So one of the things is that a physician, your primary care physician, can order this low dose CT scan, and they can, just send that order over to us. You can also give us a call here at Saddleback Medical Center. I'm available most days, and I call patients back and can give you any information that you need.
Right.
I can go over the screening criteria with you and that kind of thing.
And not only do you have that kind of information, but you guys also have smoking cessation programs. Tell me a little
Yes.
bit about that real quick.
So our smoking cessation program at MemorialCare is virtual right now, obviously because of the pandemic.
Mhm.
We've maintained that virtual type of course, but it is an 8-week course that is provided every other month.
Okay.
And it's once a week, from 5 to, I believe, 6 p.m. And you can give me a call and I can get you set up with that
Great.
as well.
Great. Well, I really appreciate you taking the time to explain all of this. I mean, it is a lot to take in, but nonetheless, at least the information is there. So thank you so much.
Yeah, you're welcome. Thank you.
You're welcome. And if you would like more information about what we just discussed, you can go to memorialcare.org/SB lung cancer. We'll be right back.